You know, like, when you're ADHD, you know, you feel different from other people, right? You do get treated different and all of that, but really, and even with depression, you know, you don't feel like anybody understands. But really, there's so many people that understand. There's so many people with ADHD that, like, have that too. Have these things. So as much as you feel differently, the sad truth is, and I think a lot of us want to feel differently. It kind of justifies the pain, right? Oh, this happened to me, and this happened to me, and this way it was different. So that makes me different. So I'm just this little snowflake, right? Really, most of the time it's so cookie cutter, you know? Like even if, I mean, there's just so much pattern to it. Like even me, it's just so cookie cutter, you know? Like paint by the numbers. Like somebody could take it and, you know, like I've got all of these numbers that are on this checklist and they can just paint them exactly how they're supposed to be, and it's showing up exactly how it's supposed to be. Yeah, I can say, you know, well, I don't respond to medication like that, or, you know, whatever. A lot of excuses, really. But these all are valid feelings. It's just nothing as unique as you feel on the inside, right? You feel like a snowflake, but really you're just like everyone else. And that can be comforting or depressing, I guess. I mean, if you're really that proud and want to be so different. I know these people. I know these people will stop at nothing to be better than you, you know? They'll try to one-up you on everything, right? Who cares, man? You're just trying to justify feeling crappy. Thank you. Justify your actions. Great. I'm not justifying anything. All of my actions are mine. I'm just explaining them. Explaining the feelings and explaining how I tend to cope with them. And, you know, it's pretty cookie cutter, I'm sure. I mean, the drinking, the eating, like, there's really not a whole lot different. The isolation. I even went so far as to buy a trailer, you know, live by myself and get a job where I'm by myself all the time. Just because I cookie cutterly, you know, feel that I'm hurting other people as a, you know, as a consequence of divorce and losing children and loss. And yes, the ADHD is very problematic. It makes this seem more extreme to me. Makes me feel more extreme. Makes the depression go even deeper. Yes, that's true. But there are so many people that that's happening to. And it's sad, and that's why I griped when our politicians are so worried about important, but not so important things. You know, we have a lot of people dying every day. We don't talk about those people. We don't talk about how many people commit suicide or die because of drugs, and we don't talk about that enough, at least. That was rooted with depression, rooted with these things, and not having resources available, you know, not having medications available for people where applicable, not having natural resources available, therapies, and if they are, we're not pushing it enough. We're not getting it in the hands of the people that need it. Not that I'm looking for a handout, I just have no power on my own to go do this. And it's hard, and like really somebody kind of has to step in for you. Kind of hold your hand and bring you over there. And, I know that sounds selfish and stupid, right? But it's kind of true. When you're in this position, like, you're like paralyzed. You're paralyzed from the neck down. You can't, from the head down, really. You can't do anything. A lot of times you can't even leave your room. You can't leave your bed. you're in bed until it hurts, and you just stay in bed because you're hurting, and that's kind of nice. So you're there to just hurt some more. And you almost sit there and convince yourself it's okay to be alone, and people are dumb, and people are terrible, or you're terrible. In my case, it's just me. I feel like it's just me. That's not necessarily true, but I feel it. I feel it, and it's so real to me. That's the hard part. It's like, it's not real, but your brain just makes it real. I mean, gosh. It's nuts how real those feelings manifest themselves, and how you respond and do things with your body to counter those real feelings and those real emotions that you have over stuff that's fabricated in your mind. It's actually quite impressive, to be honest. It's impressive that the brain can first do this. It's impressive that the brain has these defense mechanisms, because depression is a defense mechanism. It's a coping mechanism, We're not supposed to be just happy and bouncing off the walls, and like we show in our social media every day, that we're constantly happy. And then when you see the occasional post about somebody who's dealing with depression, it's hard for them to get that out, but I don't know. It's a cry for help. It could be a couple different things, but the fact that they're going on social media to do that means a whole lot, right? Then people start freaking out. They should have been walking with that person to begin with. We need to be more friendly to our friends. We need to walk with our friends, because guess what? More than likely they're dealing with a lot of these issues. You don't even have to look for the signs. People are so good at covering those things up these days and pretending. And then, when it gets too late, it's too late. I mean, that's why we screen. As a nurse, I screen people for depression. So I know exactly what it is. Exactly the signs and the symptoms, and feeling hopeless. Typically we make recommendations, but we're the ones that take their hand and help them go. We don't just be like, you should probably go in there. No, we call and make referrals and follow up. I don't know if anybody's going to make that referral for me quite yet. Maybe in the future, but not quite yet. I'm pretty good at taking it. Granted, I'm talking about it all on my blog, but I'm pretty good in the moment of not drawing that kind of attention to myself. And that's a defense mechanism too, because you're not trying to look as weak or whatever you want to look, Especially with church. It's a huge problem in churches, People pretend that depression's not a thing, or it's just such a weakness, or you don't believe, how dare you, but it's, poor people get like, they lie to themselves and think that it's, has to do with that, and it's really not. It's its own beast, and they just don't know. So in that sense, knowledge helps in that sense, because you don't want it to be misplaced. You have these feelings because you grow up with them. Depending on how you grew up, if you grew up religious, you're going to have these feelings. Just part of it all. So, but once you know it, you can start recognizing patterns, and hopefully you're making changes to deal with them. I'm trying to make changes to deal with it. I'm trying to drink less. I'm trying to... I don't ever tell myself I want to just quit this or do, not do this. The second I tell myself that I can't have it anymore, so my body just freaks out. And then I end up binging on whatever I'm not having. which I guess I'm not having a social life really, so I'm not really following my own advice.